So tell me about before the surgery. How bad was the pain?
I couldn't get out of bed some days. I couldn't stand up on my own. I mean, even just going to the bathroom, it was just about impossible on some days. So.
Yeah.
And my leg was starting to get, my left leg, I was starting to get numbness.
Now, did you have as well pain in the leg?
Yes, not a lot, but I was starting right before surgery. The last like month or so, I had lots of tingling and stuff like that.
Overall, how bad was the pain? 1 to 10?
Oh, there was definitely days that it was 10.
10.
Yes, by far.
And how bad is the pain now?
0 to 1.
0 to 1. When did the leg pain go away?
Within probably weeks, if not a month of the surgery.
Okay.
Very, very soon.
Very soon. Now, you didn't get a small surgery. The surgery was a year ago. This is the picture of the surgery. And what we did, a 2-level fusion in L4, 3, 4, 4, 5. And bone is beautifully growing, both in the front, and look at that as well. Bone is growing in the back. And how long did you stay in the hospital?
Only overnight.
Only over the night. And did you, before the surgery, did you look into your option? What were the options for your problem? Or did you talk to other surgeon?
No, I did not.
Okay.
No.
But
I was doing chiropractic. I had done physical therapy.
Yeah.
None of that seemed to be working.
Yeah. Now, how long after the surgery could you do basic daily activities?
I would say within 4 to 5 weeks.
So, now these are if you remember before the surgery we talked about, and I told you that most of my patients, vast majority of them, walk within few hours. They go home next day, which I think you did.
Yep.
And your surgery was under an hour actually.
Yep.
And we lost about less than half a cup of coffee blood. And we said you usually my patient go back to work within 4 to 8 weeks, back to the basic previous life, and the bone grows within 4 months. If you remember as well, we talked about that after open surgery, double, triple, quadruple those numbers.
Oh yeah. Yep.
And if you have done research or talked to people who have done open surgery, they wouldn't feel this good so fast.
No.
How do you know that? How do you know that?
I did do some research online and just looked into it that way. And there was people that were years out and were still having issues.
So we could achieve your results by using smaller holes, not causing too much damage. I want to ask a question because I think lots of patients struggling these days. What if your insurance obviously didn't give us any problem then, but what if your insurance says the only way we pay for it if you do open old-fashioned surgery where the surgeon massacre your back for 7 hours and you stay in the hospital 4 or 5 days and you have a 1-year recovery? If your insurance would give you only that option, what would you do?
That would have been a hard call. I mean, if I would have known the results would have eventually been the same, maybe I would have, but I don't know that I would have, no.
We have a petition now because some insurance doing it now. They tell their surgeon, they tell their patient, the only way we pay for surgery if you get that massacre surgery. And we are starting a petition. I would really love if you could get involved and help patient in your situation a year ago who are not given the choice.
Yeah.
Would you help us?
Yeah.
Thank you. I appreciate it.